You've had an opportunity today to take in a vast amount of information, starting with our overview of the Shared Care Committee at the beginning of the day, assorted panels and presentations, and of course you've just completed a whirlwind tour of the various Shared Care Committee initiatives. You'll recall that at the beginning of our program, my colleague Kelly McQuillan asked you all to take responsibility for your own expectations being met throughout the day, reminding you to ask questions and to be proactive in terms of seeking out the answers you were looking for. Kelly also asked you to keep 3 questions in mind as you move through the day. What opportunities need to be taken advantage of? What do we need to do? What do we need to change or do differently? And from whom do we need to engender more support, and how do we do that? We hope you've managed to keep track of some of your ideas and insights in your field notes. And so now we'd like to hear your thoughts. And working with your designated facilitators, and just so no one else co-ops our facilitators, can you put up your hands and your group will know who you are? Thank you. You're going to be asked to take 15 minutes to discuss the following question in light of what you've heard today and what you know, and your reflection on the 3 questions in your field notes. What's the most important action we can take to advance the work of the Shared Care Committee? So we'll keep that up on the screens throughout your discussions. Please respect your fellow participants and be succinct in making your points, as we'd like to hear from as many of you as possible. After about 15 minutes, your facilitators will lead your group's integration with 2 other groups to continue the conversation before we hear your reports. So right away, I'll turn it over to the facilitators to engage in your conversations. Thank you.
Carol, if I could suggest something as well. The Shared Care is going to be good with collaboration between the attendees. We don't have standardization.
I can actually, well, but I can take pictures of mailing it to
One of the things that I noticed throughout the day that there's so much new things.
We have different kinds of problems, and I'm sure the barriers maybe even within the medical system, where there's a lot going on in First Nations healthcare, but when we get into this play, their power, their activism, and they need to know about you guys. They need to know about this. So First Nations healthcare, I think,
So he's in the flow of the money, and then you can have more initiatives running. Yeah. And now before we do it. Other ideas.
Sort of years from now, being able to revisit where we're at.
So
the feedback is, yeah, maybe something again like this, or some opportunity.
Carry on with the conversation. I've planted that seed of contention in your heads.
So if you could just introduce yourself and report out the highlights from your discussion, please.
Okay. I'm Wingfield Remus. I'm a dermatologist at Children's and have been involved with the teledermatology project that we've talked about today. And in this group, we came up with a few different things. We talked quite broadly about how to move forward, and there were a few major themes that all of the groups had talked about. One of them is communication and how important it is to communicate what we've done here and what these projects are doing within the community. And through the communication include not only GPs and specialists, but also non-physicians in that discussion, so that we can figure out how to work together better and how to integrate these projects that have been started already and broaden them to a larger audience so people know what's going on. The second thing we talked about was engagement and continuing to have this sort of dialogue that we had during the day today, making sure that we have people who really are engaged in the process of trying to make things better and capitalize on community knowledge, because there is so much knowledge that's locally based. And if we can capitalize on that, then we can take projects that work in one location, change them perhaps a little bit, and then have them be successful in another location. But that requires engaging people across different communities to be successful. And then the last thing that we also talked about was having the support, that people who do have creative ideas have the support that they need to bring those ideas forward, to be able to implement them successfully, and then to have the tools to evaluate what they've done, because they can't do those things on their own. And so you need some, not only support, but also a process for how to bring new ideas to the discussion as they move forward.
Okay, I'm Heather Osborne, and I'm with Sienna Consulting. And so our group had some of the similar ideas. One of the, is that better? Yeah. One of the things that we talked about, first of all, is the political will to fund the projects. So it was brought up in our group that the politicians only think 3 years out, so they don't think what's going to happen 10 years down the road. So we need to be thinking about that. We want to make sure that the pilot projects that exist now are being built on and expanded and taken province-wide, so that the benefits that a few people have now, everybody can share in that. Communication was a big one for us as well. We talked about sharing information, how we could facilitate access for patients and healthcare professionals. We needed to educate and communicate with the public and professionals about self-managed care. And we also talked about a diagnosis-generated pathway to care. So all of that was under communication. That was a big topic for us. There was some conversation about allowing doctors to be more creative in their solutions to healthcare, and also within that to look at alternative types of solutions. Back here. Talked about the use of technology, so technology and how we can go about sharing the EMRs. And sustainability of the programs. How are we going to ensure that these programs stay with us and it's not just a flash in the pan and then it's gone? And the last thing was strategic relationships, that we have purposeful relationships between the physicians and patients.
So I'm Ellen Peterson, and I'm from the Langley Division of Family Practice. We had a lot of the same themes that we heard from the other two groups. Certainly technology is a barrier, and we wanted to do some more work sharing the information to help us in our decisions and to help us build those relationships. And we really thought that we needed some champions in that area to break down some of the barriers that we're experiencing. Communication as well, big theme. Communicating with shared care, communicating amongst each other, understanding, making sure that information is really flowing to the people who are working on the solutions. We were also concerned with sustainability, making sure that we have a structure that will support this type of innovation in a longer term, being able to do the things that we currently can't. That led us to funding. We had quite a few points under funding, looking at different models relating to interdisciplinary care teams, use the savings to continue to improve the system. So we talked a little bit about feeding back those savings to further fund innovation, and that we needed a stable business model to continue this work. We also talked a little bit about going beyond the physicians to the other allied healthcare professionals and including them in our conversations. The role of patients, we didn't think that we'd fully realize their potential and really wanted to involve them. We had some challenges accessing shared care, so being able to communicate with shared care, talk about our ideas in the different communities. So we wanted to improve that. And again, same as the other groups, nurturing these relationships so that we can continue to work collaboratively and do more together.
It's really important for you to know that the information that you've provided here is important to us. I know that the Shared Care Committee is meeting on Monday, and I was going through my agenda package the other day, and I believe the first or second thing on the agenda is for a fulsome debrief on today. So it's important for me to share with you that your information, your advice, your thoughts are immediately going to land with Shared Care on Monday morning to be fully discussed and debated about how do we help move this shared care agenda forward? So in terms of how quickly things happen in healthcare, that for me is light speed, getting it from Friday afternoon to Monday morning to have an appropriate discussion about moving the agenda forward. So thank you for that.